Trick-or-treating is over and no doubt kids are enjoying their candy. Today, by the way, is National Candy Day. A local orthodontist is buying back Halloween candy from area children and donating the goods to area nonprofits. Morning anchor Maya Sines sat down with them to talk about the candy buyback program.
So you've been doing this for 19 years.
19 years.
Wow. So what kind of got the idea kind of rolling?
You know, originally we started seeing a lot of broken brackets and braces and damage to appliances around right after Halloween. So that's what kind of prompted the whole idea about buying back candy, to get that out of their hands and out of their mouths.
Has it been a pretty popular program?
It's been a great program. The average buyback every year is about 350 pounds.
Oh, wow.
The most we ever collected was around 650 pounds. That was a record-breaking year.
Wow. And what kind of response do you get from the kids who come in? I mean, that's a big sacrifice for these kids to give up their candy, right? This is a big deal for them.
You know, you think it would be. Some of them are really encouraged by their parents because, first of all, parents really want to get it out of the house. I've had parents stop me at the grocery store and say, "Is that candy buyback still going on?" You know, because I have a lot of stuff I want to get rid of. So, but kids, you know, they pick out what they like. You know, a few things, and then they bring it in and we exchange it at a rate of $1 a pound, and they get the cash, and a lot of them are beaming when they walk out with, you know, some cash in their hand.
Yeah, it's a great deal for them. They get some money and they get to keep some of that candy. Now, how much is too much when it comes to eating some of that Halloween candy?
You know, it really varies from individual, but, you know, as long as they do it reasonably and still have some healthy food in addition to, you know, just some sweet things. And then, of course, brushing after they do eat the sweet things would be very important.
Right. And at the Orthodontics, what are some of the new technologies that you're seeing nowadays?
We're seeing a lot of great things. I think one of the best things that we have is an intraoral scanner where we don't have to take impressions on patients, and we can scan them and then simulate what their smile will look like after we correct their bite and their teeth. It's great.
Yeah, it's a good little preview.
It's a great preview, and because sometimes they just can't even imagine what that would be like. And then we have a device that actually accelerates the rate of tooth movement, and it makes it a lot more comfortable for them.
Okay.
Clear aligner therapy has been a wonderful thing for our practice because people don't have to wear braces and they can still align their teeth. I think about 45% of the practice is adult patients. We're seeing a lot more adult patients since we've been able to use Invisalign.
Oh, good. Okay. And last question: what is one good tip that you would give to people to have overall good oral health? Well,
As far as orthodontics is concerned, we like to see the little ones by age 7 or 8 because there's certain things that we look for in the developing mouth.
Okay.
And then make sure that they see their general dentist every 6 months and
get that
brush and
checkup.
floss. Get that checkup.
And maybe donate some of that candy. Not eat as much candy.
Yes, exchange it.
Yes. All right, Dr. Reese, thanks so much for being with us.
And if you want to take part in the candy buyback program, you can tomorrow from 7:30 a.m. until 4 p.m. It takes place at Reese Orthodontics on North 129th Street. Dr. Reese will pay children $1 for each pound of candy.